Refugees, just given the trauma that they've experienced in their home countries and, the possibility that they have been witness to violent activities or witnessed, family members being killed or, been subject to that themselves. Being able to digest and heal once they get to the United States is something that is not given a lot of attention currently in the, way our programs are structured. So we're doing a lot of work to ensure that refugees are properly screened for mental and behavioral health concerns once they arrive in the United States, and also that they have access to appropriate treatment, which is both culturally and linguistically appropriate.
If you're living to survive, I don't know that it's a priority. I mean, you look at food, clothing, shelter. Nowhere in there do we talk about health, mental or physical health, or spiritual health of an individual.
Mental health is a huge issue here in Polk County. I think we don't have enough services out there for the folks. I would say at least 50% of the folks that we encounter on a daily basis have some sort of mental health diagnosis.
I think stress in general is affecting their well-being. I think the safety is definitely a part of that. Are my children safe? Am I safe when can we go for a walk as a family after dark? But that stress is compounded by, am I going to be able to find food to feed them? Am I going to make enough to have these things? Is there a place I can get help if I don't? It's those things. God forbid somebody gets sick. What are we going to do? That kind of stress is so wearing on people physically. I think that I think we see more parents that start to feel physically worn down.
Something's broke that we have a certain population of people that can't break the barrier to make a livable wage, that continue to live in poverty. It's a cycle of poverty. And so we're tracking trauma. As we've begun this project and this initiative, Project Iowa, there's been a lot of work done here in Iowa around ACEs, Adverse Childhood Experience Scale. Maybe that is one of the things that is a barrier to this population, is unresolved trauma.
Traumatic events, especially repeated traumatic events in early childhood and life, we definitely see mental health issues that people have to have addressed.